Good afternoon, everybody. I'm Dr. Anthony Levinson. We're here with another iGeriCare live event, and here we are live at Baycrest, home of the Center for Aging and Brain Health Innovation, and we're really grateful to have Marilyn Reed here with us today. Marilyn is a practice advisor for audiology here at Baycrest, has done a ton of work looking at the relationship between hearing loss, audiology, the study of hearing, and amplification or increasing the signal for people living with cognitive impairment and dementia. Master's in audiology from the University of Southampton in England, has been practicing here at Baycrest since 1997 and worked in a variety of clinical settings. Currently the principal investigator on a research study sponsored by CABI, who also has powered our iGeriCare initiative. So we're really excited to have you and to talk to you today about such a hugely important topic and maybe a misunderstood one about hearing loss and dementia.
Thank you for giving me the opportunity to talk about it. Thank you.
So why don't we'll dive right in there and maybe just start a little bit talking about the link between hearing and cognition more generally. So tell us a bit about the role of hearing and cognition, and I guess cognition and hearing. It's almost a two-way street, isn't it?
Yes, it certainly is. And we've known for many years that there is a link between the two, but it's really in the last 10 years that there have been some very large-scale population-based studies which are tracking the association between different health conditions over the lifespan, that are showing that people who have hearing loss are at a greater risk of developing dementia. And in fact, so much so that there's a correlation between the degree of hearing loss and the likelihood of developing dementia. So if you have a mild hearing loss, you're twice as likely. If you have a moderate hearing loss, you're 3 times as likely, and so on and so on. So definitely there is a close link. And of course, in 2017, the Lancet commissioned a study where we were looking at, they were looking at the possible causes of dementia. And also they were looking at it from the perspective of preventing perhaps things that we can control, the risk factors that we can control. And I think that's when it really became a surprise to everyone, because the Lancet's a very well-read and well-respected journal, that of those potentially modifiable risk factors for dementia, hearing loss, in fact, is one of the leading ones, if not the leading one, accounting for about 9% of the risk. And when you think about that, if hearing loss is a greater risk than things like obesity and depression and life factors that we can control, like smoking and so on, then definitely it's something we should be paying attention to, and that certainly did get a lot of people's attention.
I think, my colleague, Dr. Stramko, and I, we recently did a presentation talking about dementia and prevention, and this is a really hot topic now. What things can people change to try to either reduce their risk of developing dementia or maybe delay the onset? And there's a wide number of these risk factors, but it would seem like hearing loss might actually be one of the modifiable ones, the ones you can change, and there might be more interventions or things to modify that risk factor that are maybe easier than some of the diet or lifestyle changes as well.
Absolutely, and that's what we keep saying. It's relatively low-hanging fruit. It's something that everybody can do something about, and it's something that we would encourage everybody to think about getting a hearing test, for example, when you reach that midlife factor where it starts to become a significant risk factor. So the problem really, and we've always said this, hearing loss is an invisible disability, and it's one of the only truly invisible disabilities, along with mental health issues. But unfortunately, because it's invisible, people don't think about it. A lot of people are not aware that they have a hearing problem, and a lot of people deny that they have a hearing problem, even if they are aware of it. And unfortunately, sometimes people are still told by their physicians that it's a normal part of aging. But that doesn't mean to say that you shouldn't do something about it. It's like vision. We still get eyeglasses if we have a vision vision problem. So I think one of the first steps is to get a hearing test and then see if you do have a hearing loss at all, then let's be proactive. Let's do something about it rather than sweeping it under the carpet or trying to hide it. And we definitely need to be much more proactive. And as physicians and healthcare providers, encourage our patients to be more proactive about it.
Do we know why it is that people don't go to get their hearing tested? Like, what are some of the factors? I mean, I think you said sometimes maybe people are in denial or sometimes they're not aware, but are there factors that stop people? I'm sure there's some of the caregivers out there that are saying, look, I've tried to, get the person I'm caring for to go for a hearing test, and they just won't go.
That's right. And I think one of the big ones, other than just denial, is stigma. Okay. And there's still a lot of ageism associated with hearing aids, so that I know that people say that they're afraid they're going to look old if they wear hearing aids. And my answer to that is, you're going to look a lot older if you're not wearing hearing aids and you're asking people to repeat things, or you seem to be out of it because you're basically using that as a coping strategy rather than making the effort to hear and stay involved in the conversation.
I just tell people they're going to look old anyway. You really look old. So what's a hearing aid? Yeah.
I know. And the other thing is, don't try to hide it. And there's so many people, it really bothers me that the advertising for hearing aids talks about them being so tiny that they're invisible. I tell my patients, how can you expect people to use good communication strategies and help you to hear better if they don't know that you have a hearing problem? So I always encourage people to be assertive about it. And when you meet a new person, let them know that you are a little hard of hearing and go one step further than that even and say, and it would really help me if you speak slowly or face me when you're talking to me or something like this.
But I mean, it is true, though, that some of that stigma, or at least denial, is maybe based on thoughts of what hearing aids look like and how they perform that was maybe true 20, 30 years ago.
Exactly.
So the newer generation of hearing aids, the fact that they are maybe a little bit more stylish may help people overcome some of their own barriers.
I think you just hit the nail on the head when you said about 20 years ago. I think things have changed so rapidly. I've been practicing for over 40 years, and I can't tell you how much hearing aids have changed since I've been practicing. But also it's a generational thing. So if I talk to students that are younger and I tell them about stigma, they truly don't understand it because they've all got something in their ears 24 hours a day practically. And so I think it's this generation that thinks that it's associated with aging if they're wearing hearing aids. And hearing aids are truly becoming communication devices. So they're not just amplification devices anymore. Now hearing aids have Bluetooth connectivity so that your hearing aids can be connected to anything. If you want to listen to your music through your iPod, whatever, then you can be Bluetooth connected to it. You can be connected to your smartphone so that, and one of the biggest problems for older adults, by the way, is hearing on the phone. And more older adults are getting smartphones now, probably because their kids want them to have them and be in contact. And so that way, of course, they can hear the phone in their hearing aids, and it hugely improves their ability to hear on the phone.
And I think the other, major technology that a lot of older adults would use is televisions.
Exactly.
And again, there's been improved amplification technology.
So those typically are the two things that bother older adults the most when it comes to hearing loss. Is hearing on the phone, because that connects them to the outside world if they're at home a lot, and watching TV, because that's the chief source of their entertainment. And again, if you have Bluetooth hearing aids, you can have a TV transmitter that's connected to your hearing aids, and you hear the TV in your hearing aids, which is not only good for you, but it's good for your spouse or your caregiver who's complaining that the TV's turned up too loud. Because that's often what makes people come in to get help, because it's not they themselves that have noticed they have a problem. But that's one of the typical signs. Oh, mum and dad have the TV so loud that the neighbors are complaining. And so that's a great way to solve that problem as well. Yeah.
So when we think about, it sounds like there's a fair amount of risk or the association between hearing loss and cognitive impairment, like dementia, and the more severe the hearing loss, the higher the risk of the dementia. How common generally is hearing loss?
It's very common. It's actually the third most common chronic disability after hypertension and arthritis.
Wow.
And to give you an example, about a third of the people over 60 have some degree of hearing loss. About a half of people over the age of 70 have some degree of hearing loss. And if you're over 80, then even higher, 80%. And so we know that a lot of the people that we're working with here at Baycrest have some degree of hearing loss. And we really need to pay attention to that. And certainly, as I said, it's something that we can do something about, and not just with hearing aids, but with good communication strategies, and there are other options as well.
What are some of the signs or things that somebody who is a care partner, what are some of the things that they might notice that might make them suspect that the person they're caring for with dementia has a hearing loss?
Well, the obvious one is asking for repetition. So people get tired of repeating things. Another thing is having the TV too loud, for example. There are many different subtle signs, but these things are also very common for people that are developing dementia and cognitive loss. So generally the communication problems are the same and the symptoms are very similar, which is why it's so very important to have both things assessed. And if you're concerned about memory problems, it's important to have your hearing tested as well. Because, for example, one of our physicians, Dr. Gordon, used to say that often in his clinic, if people addressed the hearing problems, they would often make the memory issues a little better, because part of it is hearing. You don't remember things that you don't hear. And if you're showing up at the wrong time in the wrong place for appointments because you didn't quite get what somebody said on the phone, then people are going to start worrying that maybe you do have memory issues. And
I think that's, so what we see with dementia is often memory problems, but also problems with language and language comprehension or understanding it. And as you say, those things could be mimicked entirely if you were not able to hear the thing to commit it to memory or hear what somebody said in order to understand it. And all of us as we age, you were asking me about the links between hearing and cognition, and we understand much more now about age-related hearing loss than we used to. And we know it's not just about sensitivity loss. It's not just about making things louder. Because take myself, for example, my hearing is actually pretty good, but I'm really having a hard time when I go out with friends in noisy restaurants. And a lot of my friends are having a hard time in noisy restaurants. And that's not so much a hearing thing as a brain processing thing, because we've learned so much, a lot of the research done here at Baycrest actually, about how as we age, our speed of processing information slows down, so that if people are speaking very quickly, then we have difficulty following them and keeping up. We also find that in a noisy environment, especially in a restaurant where the background noise is other people talking, then we are having much more difficulty as we age, because we lose our ability to inhibit the background stuff that we don't want to hear. When we're young, our brain does this amazing job of sorting out what we want to hear and ignoring the rest. But we lose that ability as we get older. So even if we can account for the sensitivity loss by making things louder, we're still going to have trouble because of those other age-related things. And when you have cognitive loss and memory loss as well, it makes things even harder, because your working memory is critical for keeping track of conversations and for filling in the gaps of the things that you miss. And I think some of those situations you described are also really challenging for people with cognitive impairments, where there's more than one person talking at a time, and the environment is maybe overstimulating, so it's hard for them to focus. So what should a caregiver do if they are concerned that the person they're caring for with dementia might have a hearing loss? So what are the practical things that they should do?
I think the first thing obviously is to get the hearing assessed. And sometimes people are very resistant to that, but I think that sometimes it's important to motivate by saying, okay, well, you may not want to get your hearing tested for your sake, but I would like you to get your hearing tested for my sake, because I'm getting a little tired of raising my voice and having to make sure that I'm always coming to the same room as you and so on. So I think that the important thing is to stress getting a hearing test. Now, you can go to your doctor and ask your doctor to refer you. I think it's always important to have your doctor check your ears The audiologist can also check your ears. But of course, one of the common things that happens as we get older is we have wax accumulating in our ears, and that can actually be one of the common causes of hearing loss that we need to get sorted out before we get a hearing test. And now, of course, there are a lot of apps. There are apps for everything, and there are apps for checking hearing. So if you can't persuade a loved one to go and get a hearing test, or if you don't want to go yourself, there are always apps for checking your hearing online. In fact, the World Health Organization launched an app last year called the Who Hear app, which is Hear, exactly. App. And that's based on listening to digits, which is not just a pure tone test.
And is that a relatively reliable app to recommend?
An app is only as reliable as the environment that you're testing in. So if you're testing at home, you have to use a quiet room and you have to have ideally good headphones. But I'm just explaining that there are things that people can try at home to do to
better
check
to
their
have
own
it
hearing.
Go to your physician.
Much better to
and
go to
get referred for a professional audiology test.
But at least that can give you an idea, a rough idea, and it's nothing like a full hearing assessment, but it gives you a rough idea, a screening test for your hearing.
And can a person who is living with dementia and has hearing loss, can they benefit from hearing aids?
That's a great question. And we actually have done some research in that area here at Baycrest, and we have found that yes, if you make accommodations for memory loss and you can make appropriate recommendations for help, and when I say help, because it's not all about hearing aids, there are other things we can do. But even with hearing aids, if we keep things simple, and if we address memory issues, for example, I'll give you an example of a game changer for us. One of the biggest problems for people was changing batteries in hearing aids, because as hearing aids got smaller, the batteries got smaller. And there are two main issues with batteries. One is a physical thing. Our vision and our manual dexterity gets worse as we get older, so it's physically difficult to change a battery.
And they were really tiny.
Really tiny, exactly. Yeah. But the other thing is memory, remembering to change a battery. And in fact, because as audiologists, we often see people over an extended period of time, that would sometimes be the first sign that someone might be developing memory issues, because for years they've been managing their hearing aids just fine, and then suddenly they're coming in complaining that the hearing aid isn't working. Lo and behold, it contains a dead battery. So that's an indicator as well. But the thing is, the big change for us was when manufacturers started making rechargeable hearing aids. So now the hearing aids go in a charger at night instead of going in their case, and they're ready to go in the morning without having to remember to change batteries.
That just seems so much easier for people to manage.
It is, and it's easier for caregivers too, because they're not having to remember to buy batteries all the time. But the other big issue when people do have dementia, of course, is that if they are wearing hearing aids, then they're going to be very reliant on the caregiver to help them and support them. So that's a big factor in our decision about whether or not it is appropriate to recommend hearing aids. What is the support that people have at home? And is it possible for the caregiver, especially if they're a burdened spouse, sometimes we find that spouses and caregivers are concerned that getting hearing aids are going to add to their burden. But what we found is that actually in our study, when hearing aids were used and recommended appropriately, it actually helps to relieve caregiver burden, because if by improving communication, it's helping you, the caregiver, to have a better relationship with...
Less frustrated, not having to repeat things as often.
Exactly. And also, some studies have shown that when people are hearing better, it reduces their behaviors. So that, because often behaviors are based on frustration or pain or hunger or something that is not getting communicated.
What's happening in the situation.
Exactly. And so improving communication can help that too. Yeah.
Well, we'll come back to a few topics. I'm going to take a few of the questions that people have sent in, and then we'll come back to follow up on a couple of things. So this is a really poignant caregiver story that came in, and this person describes being a care partner for their father for many years, about 15 years, and that he had been, the father who was being cared for was severely impaired in one ear for most of his life. And then at the point that he was transferred later in life to long-term care, they just described a lot of frustration trying to explain to the caregivers in long-term care about the hearing challenges, having to constantly kind of remind the staff. And I think it was just, what the take-home message was just how important it was as the family care partner to be an advocate if there was a hearing loss, and to, the things that you suggested, that the person living with dementia may not be able to express that they have a hearing loss, or, please speak to me slowly, or speak in my left ear, which is my better one. But this person really just described how important it was as a family care partner to be the advocate to help with other members of the healthcare team.
Yes, yeah, and I really empathize with caregivers that have this issue. And I think, again, it goes back to the fact that hearing loss is invisible. So a lot of when they go into supported living, people looking after them may not realize that they have a hearing problem. So yes, you do have to advocate, unfortunately. But once I just find I've worked in long-term care for many, many years, and I just find that you have to just keep reminding, and there tends to be a high staff turnover, so you're having to tell new people all of the time what the issues are. But it doesn't hurt to put a sign up saying that you have hearing loss, and to please communicate appropriately.
That's a great practical suggestion. Have the sign in the door.
And also if they have hearing aids, of course, then there's the worry that they're going to get put on in the morning and get taken off at night. So again, sometimes we do put very simple signage up reminding caregivers of that. And there are things you can do, like, for example, we had like a Tupperware container for people's valuables like glasses and hearing aids, and asking staff to make sure that they got put away at night and put on again in the morning. And if
not
you can
put through the dishwasher with the other Tupperware.
And not put through the laundry. And there are many things that you can do to help, especially to help avoid loss. But it is very challenging in long-term care environments, and I know that you really do have to advocate. But another thing you can do if you're concerned about hearing aids getting lost, but you still want your loved one to be able to hear, is we use other devices at Baycrest, like a pocket talker that I brought along today, which actually is a great alternative for a loved one in long-term care, where it's very easy for staff to use, because I often find that staff are concerned that they're going to damage a hearing aid or break it, so they're worried about using it.
So tell us about the pocket talker.
Pocket talker, it's just one example of a very simple amplification device that can be very effective. So the person wears headphones or earbuds, or they can have another type device that goes under their chin.
So the person with dementia or hearing loss wears the headphones?
Yeah, and then they can also wear this, because if they can wear it in their pocket, or actually at Baycrest we got some volunteers to crochet some little pouches for women to wear around their neck because they didn't have a pocket to put it in. And then this can help enormously. And
pouchy talker doesn't sound quite as good as pocket talker, but
that's right.
That's why.
But you can adjust it at the side there, and if you want to put it on so you can see what it's like, we can. It's very lightweight, and then you just gently turn it on at the side. You can see that it's very effective. You don't have to turn it up very much.
I have it at the lowest volume.
Right, exactly. And you can get versions of this that are rechargeable as well, but this takes like AAA batteries or something, so it's
a
pretty
microphone,
easy.
And it's just amplifying
exactly.
the sound.
And if you want to be able to put the microphone closer to the speaker, then there's an extension cord that comes with it, so that you can have the microphone closer to the speaker. For example, if you're having lunch with your loved one, you can sit on one side of the table, they can sit on the other. And you can even put this close to the TV. There's a little holder that you can stick it to the TV speaker, so that you can hear the TV better as well. So there are a lot of good uses for this. And of course, it's very simple. It's a lot less expensive than hearing aids. It's easier to use, and it's more durable.
Less expensive if you lose it.
Definitely, yeah. And it's more durable, so you can drop it and not likely to put it through the washing machine.
And we were talking before we started the event today, if you were maybe having trouble convincing somebody that they had hearing loss, or to go for a hearing test, this might also be a little gateway challenge, that you could try the simple pocket talker amplifier, and if the person noticed a big difference, or the care partner noticed a difference, that might be
Yes.
something else to convince them
Definitely.
to go.
I've seen that many times when people swear that they don't have a hearing problem, their hearing is fine, and then they put that on, or the caregiver puts that on for them, and there's an immediate difference. You know, the face lights up. You realize that, yes, it's very much easier to hear. And this is so important because one of the big risks, of course, is social isolation.
Yeah.
And when you go into a new care facility, it's very difficult to make friends or get to know your peers if you're not able to hear them well. And so there's a huge risk of social isolation for people with hearing loss, especially when they move into a different
I think people
transition.
are talking about social isolation as another risk factor for
Absolutely.
dementia.
That's
so
right.
I think you have now this possibility of somebody with hearing loss becoming more socially isolated because they're having trouble in their interactions, and so maybe there's a double whammy
Exactly.
with those two factors.
And even a triple whammy when you think about how that feeds into depression.
Yeah.
And another big risk factor for dementia.
The one other comment I would just make on the story about the advocate in long-term care is in the hospital setting, I find that the same kinds of challenges often occur, even if somebody's coming into hospital for, you know, an acute illness. They're not necessarily staying there, like they're not moving to a new home. But even within the hospital, I think the staff are very impatient. Everybody's trying to move quickly. They're not necessarily taking the time to ensure that somebody is able to listen. The ambient noise between all the IV poles and beeps and things going on, it's really loud. So I think it's a challenging environment for people with hearing impairments.
It's hugely challenging. And if I can just add to that, even somewhere like Baycrest, where we have a rehab unit where people come following a hip fracture, perhaps, where they come for lots of great therapy, if they can't hear well, how much are they really benefiting from that interaction and that therapy? Many of the things that happen in the hospital, of course, are based on people being able to hear what instructions they're being given. And
I was always struck when I first started working in the hospital as a medical student. I found it really embarrassing that people who spoke a different language other than English were labeled as having a communication disorder. And I feel it just sort of, I found that so bizarre and kind of offensive, but it speaks to the kind of, there's something with this person that's inconvenient in some ways. So I think it is, again, back to the importance of, as a care partner, of being an advocate.
Yeah. And another kind of irony is sometimes people get told to leave their hearing aids at home because of the risk of loss. And so I think, you know, as an advocate, you kind of have to fight that.
Here's another story, or just a comment. There's an obvious connection, and it makes such a difference. Lots of times, people who have severe hearing loss are confused as having dementia, i.e. get mislabeled as having dementia when they don't hear what folks are asking. So
yes, exactly. And it's because the symptoms are so similar, you really don't know. You really don't know unless you assess both.
Another comment that came in, my dad has dementia and wears hearing aids. However, the TV volume goes way up when he's watching. So I asked him why, because he was wearing the hearing aids, but the volume was up. Is it that you can't hear the program, or you're having a hard time understanding it? He looked down at the floor. It took him a moment to answer. His answer was because he sometimes doesn't understand it.
Yeah, and that's a lot of people do say that. And the thing is, as I was saying with age-related hearing loss, even if you can hear loud enough, you still might have difficulty processing that information. And so the problem is that the more effort you have to make to hear, the fewer resources you have left for processing and storing things into memory. And if if your memory is compromised, then it's much harder to follow and keep up. And that's why the other thing is, on TV, people complain that people speak very quickly or they have an accent. And so we always recommend that even if you have hearing aids, put those captions on, activate the closed captioning, because if your vision is good enough for you to read them, then at least you can fill in the odd gap if you miss something by reading the words.
What I would say based on the education literature is if you are not having a problem understanding what is happening in the program or what people are saying, then it might actually be better, because we know it's better for learning if you don't have both as a distraction. But I think for sure, if you are having problems understanding, or it's accented, or maybe a program that is a bit more technical so that some of the vocabulary used is more challenging, those would be things where the closed captioning would be beneficial.
It's amazing how many older adults love to watch the English mysteries
Oh,
and
the
programs,
BBC?
and they find it difficult to follow an English accent, and that's what I'm told by many of my patients.
Yeah, I don't understand
like,
a word of what you're saying, actually.
So they like
I
the
understand
captions.
that.
I have been here for over 40 years. So.
Well, yes, you don't have any accent at all now.
Thank you.
So here's another comment. My husband used to wear his hearing aids all the time. Now he doesn't know what they're for or how to use them, so consequently he no longer wears them. And yes, most definitely gets confused now or misunderstands because he doesn't hear properly.
Yes, that's very common too. We find often when people do, as the dementia advances, people do prefer to stop wearing their hearing aids, or they've stopped wearing their hearing aids, or they resist having them put in. And interestingly, we were visited by an advocate for people with dementia who has dementia herself, and says that she found over the years that she became very sensitive to loud sounds. And so I think that may be the case. We don't know for sure, but perhaps if there's a lot of noise on the unit, or if the TV's on loud, or if there's music as well, it just adds to the confusion, and the reaction is to remove them.
And I think that was, I feel like one of the stigmas against hearing aids, and based on the sort of ones from 20, 30 years ago, was that the amplification was very indiscriminate, and you might also get feedback on them. But basically, just what you described, that it was almost too much amplification that led to loud sounds.
And that isn't the case with hearing aids anymore. I mean, we are able now to program hearing aids very, very specifically for the hearing loss, so we can make sure they don't exceed discomfort levels. But the problem, of course, with somebody with more advanced dementia is it's difficult for us to measure those discomfort levels, and often we're programming hearing aids based on results that we had, in the recent past, rather than very, very recently, because they may not be able to give us that detailed information anymore in terms of...
I think what you were saying before about the number of people with hearing loss, would you say that it should be recommended that everybody over the age of 60 gets their hearing tested, just because of how common it is? And then you'd at least have some kind of baseline that if somebody did develop cognitive impairment and it became harder to do the testing, or to get more information from them, at least you'd have a sense of how to help.
And I would love to see physicians recommending a hearing test in the same way that other tests are recommended when we reach a certain age. I think that would be really important, and it's a very easy thing to do. There are many for example, we're doing a study now where we're hearing screening with a tablet-based screening test in the memory clinic here, because we feel it's important for everyone involved to know if a person coming for a memory assessment has hearing loss. And we may think we know, but when studies compare self-report with actually measuring hearing loss, there's quite a discrepancy there.
I feel you touched on before the denial. I think there's a generation of older adults that experience the stigma, or their own, it's almost like self-stigma and ageism, and they are just not willing to admit that there's a hearing impairment, even if everybody around them is commenting on it.
That's correct.
One of the issues I wanted to ask you about relates to cost. And in Ontario, if I, as a physician, make a referral to a hospital-based audiology clinic, then it's covered under our provincial insurance plan. But not everything in the world of audiology is always covered. So cost could be a barrier for certain things. Do you want to just speak a little bit to, I mean, it's different province by province, but maybe speak to some of that.
Absolutely. Cost is definitely a concern for many people. And so you're correct. Hearing aids are very expensive. So they can range anywhere from like $1,000 to $3,000 each, and so it's very costly. The government of Ontario, the Assistive Devices Program, pays $500 towards the cost of each hearing aid. So if you're getting 2 hearing aids, then you're getting a total of $1,000 towards them from the Assistive Devices Program. Some people are also eligible if they have a social worker, if they're eligible for other supports from the government, like ODSP and so on. Some people are eligible through workplace compensation. Some people are eligible as veterans from Veterans Affairs Canada. But many people don't fit into those categories. And so what do we do for them? At Baycrest, we do actually have a fund that some people are eligible for. And we've also started recycling hearing aids. And in other provinces, I know that there are other groups of audiologists that do this too. So that sometimes when people want to move on to a more sophisticated recent hearing aid, or someone passes away, then they will bring in the hearing aids as a donation. And now the digital hearing aids can be reprogrammed on the computer to be re-specified for a different person's hearing loss.
Tailoring it specific,
exactly.
Even if it's a previously owned, previously loved hearing aid, it can still be personalized or tailored.
Because we can custom make a different earpiece if you want customized earpieces. But there are certainly ways of addressing it. And also, of course, it's not all about hearing aids. We talked about the Pocket Talker, which is much less expensive, a fraction of the cost.
No, the Pocket Talker, I can't remember if you mentioned it, but you told me it's about $180 Canadian.
Mm-hmm. And of course, if you want to get into it, there are also now some over-the-counter devices that people can order online. We just say there that you have to beware because these devices are not regulated. Hearing aids that we prescribe and fit here at Baycrest and that are partly covered by the Assistive Devices Program, they are all regulated. They're all tested and regulated.
They're a medical device.
Exactly, they're a medical device. Where if you order something online, and anybody that goes to Amazon can see 100 different things they can order.
Well, and I think apparently some of the most recent studies have also suggested things that you order particular brand names, you may not receive even if you think you're ordering the brand name. So I think there's some wariness.
Yeah, well, with no regulation, you certainly have to beware. But regulation is coming. Certainly in the United States, the FDA is going to be regulating a new category of devices, which are not, they're over-the-counter hearing aids. They're not the same as the medical device hearing aids.
So for care partners, probably around this issue of cost and what's covered, probably talk to your doctor, and going to see the doctor and getting a hearing test likely to be covered on all the provincial plans, but best to find out. Some people may or may not have out-of-pocket insurance, which I think typically covers percentage of testing and amplification devices or audiology devices, but maybe also a call to a community or social service would be warranted to get clarification in your province.
And again, discussing this with your audiologist when you go to have a hearing aid prescribed, this is definitely one of the main things that we discuss with you, and always we will try to help you to get the help that you need. Yeah.
Great. Here's a question. My mother has had 2 hearing aids for very long and is living in a nursing home. The challenge is having her not take them out and put them somewhere where they cannot be found. The batteries make noise when they need to be charged. I can tell because Mom will say, "Shut up," and she's talking to the hearing aids. And the batteries are kept in the med box. They change the batteries every Friday or when they suspect they need to be changed. Because the hearing aids can be in her pillowcase during the night, etc., we decided that the dentures, glasses, and hearing aids will be put away in the med box at night. So I guess we talked about some of the challenges of coming up with a plan.
Yeah, if I could just address a couple of those things though. One of the things we do for our patients in the residents in the nursing home here, we always try to attach a tether to the hearing aid. And the nurses specifically request that, actually, which is great. So no matter the style of the hearing aid, it is possible to attach a tether. And it could be, sometimes we do it as invisible as possible. So we use fish line, and you can attach it to the back of the clothing. Sometimes the staff like it to be very visible so that they can see if the hearing aid is. So we'll put on a red string. It depends on how concerned the wearer is about whether it's visible or not. But the other thing is, I love the fact that she tells the hearing aid to shut up, because, of course, previously we didn't have ways for the hearing aids to tell the wearer if the battery was getting low, but we have had for a few years. And initially it would beep, it would give a series of beeps when the battery needed to be replaced. But now we have voice commands, which is very helpful, because how can we expect people to know, especially when they have dementia, what those beeps mean? But now we have the hearing aid telling us battery low.
Okay.
And so that's, I'm assuming, what is the case there, that the hearing aid is talking, which is actually very useful. It's very helpful, because you're not having to interpret what different beeps mean.
And could be satisfying to tell the hearing aid to shut up. I'm not going to begrudge that.
You can change the language. So some people prefer a woman's voice, some people prefer a man's voice, some people prefer...
But I like the practical suggestion of potentially some kind of tether or something, just to make it more obvious that it's in, that it's not in. And I think what you mentioned before too is a couple of simple signs that say, you know, this person has a hearing impairment, should be wearing their hearing aid. So some of those very practical, simple strategies in long-term care, I think, would be really beneficial. So.
Just a word of caution with the tether. Make sure that the staff know to remove the hearing aid before they put the clothes in the laundry, because that's the only downside of that, I'm afraid.
Here's a comment from Beaumont in Canada. I had a tour in a long-term care facility yesterday, and I was told that some patients that seem like they have hearing loss actually have a longer time, or take a longer time processing what has been said earlier.
Absolutely, yes.
And I think that sort of speaks a little to what you were saying, that there's a number of different things that impact on the comprehension of language, brain processing, some of which slows down with age, processing speed, one of the things affected, and comprehension with dementia. So.
And that's if you don't have a hearing loss. So if you do have a hearing loss on top of that, then, as I said, there's all these gaps in information that you're constantly having to try to fill. So while you're trying to think, oh, what was that word? Then you're going to miss the next bit, and so on. So it's really important to let people know that you need them to slow down.
We have time for a few other quick questions. Does tinnitus have anything to do with dementia or the death of brain cells, and is there a cure?
That's a big question. There are many, many different causes of tinnitus. It's kind of like asking what causes a headache.
It's
it could be related to the brain. It could be related to your hangover. It could be too much coffee. It could be so many different things that actually influence whether we have tinnitus or not. Things like stress and how much sleep we're getting, how anxious we are, can all affect it. And of course, the big one is noise exposure. So if there has been a lot of noise exposure, even when you were younger, then that can result in damage to the hair cells, which can result in tinnitus.
So hearing loss is definitely one of the things that can result in tinnitus, but there are a number of different things.
Many different things.
And it's relatively common.
Very common.
And it's not, I think it's important to say, it is not necessarily a marker for dementia, though.
No, it's not.
So
but it's
many people have tinnitus without having.
They do. It's very common. But it's always good to get it checked out, especially if it's on one side and not the other, because many things like noise-induced hearing loss and things affect both of our ears. So this tinnitus might seem to be in our head. But if it seems to be more on one side than the other, then it means that probably something's happening on one side that's not happening on the other. So it's just an indicator that you should definitely get it checked out. Just like you should get bad headaches checked out, definitely.
What percentage of people with hearing loss get dementia?
As I said, it depends on the degree of the loss. So as we age, we develop hearing loss and dementia, but people with dementia tend to have more hearing loss. So there's more hearing loss in people with dementia, more dementia in people with hearing loss.
It's hard even if we do see it as a risk factor and these strong associations for any one individual person, you can't necessarily say, oh, it was the hearing loss that caused the dementia.
You can't, we cannot say that. There's a lot of research being done in this area right now, but we're waiting for the randomized controlled trials, because even though we do have some research that seems to indicate that when you address hearing loss with things like hearing aids, it does seem to indicate that it may ameliorate the cognitive decline.
Right.
However, we don't know if that's because they got hearing aids or because they're the type of person that would go and get hearing aids. There may be other variables there that we don't know about. So that's why it's important to wait for these randomized controlled trials where they're actually looking at large numbers of people, over 800 people at the Achieve trial in the States, which should be finished, I think, this year. So it'll be interesting to see the results there.
We'll have to do a second comeback session, second live event.
But even then, we should know more. But right now with the studies, we can say that there are so many benefits to hearing better that you are going to have health benefits just from being able to communicate better, have less stress, less anxiety, less social isolation, and so on.
So there's so many compelling reasons over and above whether or not it might affect your risk of developing cognitive.
Yeah.
One final question here before we wrap up. Is there a hearing aid that reduces sound sensitivity?
That's a good question. So you're talking about people that are very sensitive to all kinds of sounds?
I'm gathering that from the... I only tell you everything I know. That's all I know.
Okay. So generally, when people are super sensitive to sounds, they might think that they need to wear earplugs to keep the sound out. But in fact, when people are sensitive to sounds, it's a better approach to try to desensitize them to sound. So to actually wear something with low level sound more, so that you're actually getting the brain used to it. This is the same kind of theory when you're trying to help people with tinnitus. So what you're doing sometimes is trying to desensitize them to the tinnitus by having other sound there all the time, so that the brain gets used to sound being there all the time. But hearing aids, there's so much we can do with hearing aids now. So we can make sure that they only amplify up to a certain level, so that we're protecting people who are sensitive to loud sound. We can have hearing aids with noise generators for people with tinnitus, so that we can choose, you can choose the sound that you want to listen to, because some sounds are more helpful than others. So some people like sounds like the ocean, some people like more musical sounds, some people like sounds like birds. There are many different types of signals that you can choose your hearing aid to generate for you that might help to desensitize you.
So before we wrap up, though, maybe just do you have any key strategies or communication tips for care partners for communicating with patients who may have hearing loss?
Yes.
For their, not patients, but basically for people that they are living with dementia who also have hearing loss. What are some of the key tips that you usually advise people?
Yeah, I regularly give out a sheet of communication tips to my patients and their caregivers, because whether or not you have amplification, it's still so important to communicate effectively. So one of the most important things is speaking slowly. This allows people to have time to process what you're saying and to fill in the gaps. It's also important not to shout. You can speak a little louder than normal, but raising your voice tends to make people more anxious. And when you're more anxious, you don't hear as well. Keep sentences short and simple. And if you have to repeat things, try to say it a different way. So instead of saying the same thing again and again, which again tends to make people anxious and they're less likely to hear you, try using different words, rearrange the sentence. And of course, keeping background noise down as low as possible. So if you're visiting with somebody, turn the TV off, turn the radio off, maybe even take them into a quiet area rather than having a visit in a cafeteria or a noisy restaurant. And when you're having a group, say you're at a family dinner, and my patients tell me this all the time, that they love being involved in the family dinners, but they find it so hard to follow. Some people say they just sit there like a dummy. And that's really unfortunate, because the social participation is so key. So if you're in a group, try to speak one person at a time. That's going to make it much, much easier. And always face the person that you're speaking. Remember, when we develop hearing loss, it's a very gradual thing, and we become more and more gradually dependent on that visual information. So even though many people may swear they don't lip read, we all actually are pretty dependent on lip reading as we lose hearing. And so I often find my patients say they can hear better with their glasses on, and that's because when you can see that subtle visual information, it's important. And so make sure you're facing the person. And also, I say write keywords if necessary. If someone's getting upset, or if they're not sure, especially if you're making an appointment, then write it down so that they have that to refer to.
I think just what you suggested too, in terms of, if you're going to see your doctor, a follow-up assessment, or you know that there's going to be a cognitive assessment, do everything you can to make sure that vision, hearing, all the special senses are in tip-top shape for that appointment, if that's going to be an accurate cognitive assessment.
Wear your glasses, wear your hearing aids, absolutely.
Anything else that you want to say about what you're doing here at Baycrest? Anything you want to plug before we wrap up?
Sure, yeah, we've been doing some research at Baycrest in hearing and cognition, and for the last 8 years or so, there's much research here at Baycrest. I'm just talking about me personally. I'm a clinician, so I feel very fortunate that I've had a chance to do some clinical research, and we started out by just doing some cognitive testing on our patients who routinely come into our clinic every day. Remember, our average patient age is 85 years old. Okay. So we did some cognitive testing just over the period of a summer that we had a student working with us, and we were quite shocked to find that about 80% of our patients have some degree of cognitive loss. This is not dementia, we're talking about cognitive loss, including mild cognitive impairment. And that led us to do some research where we were testing people's cognition and to studying if it helped us as audiologists to make better recommendations for them and what recommendations work best for them. So that was very useful. Then that kind of flipped to the opposite with neuropsychology, where they were testing the hearing of people there that came into neuropsychology. And they found that over 50%, 56% of their patients actually had significant hearing loss. So it changed the way they practice as well.
And just what we were saying, you make sure that you sort of augment or amplify or at least improve the hearing loss as best as possible to really help that person with their cognition.
And that led to the current CABI-funded study in the memory clinic here, where we're adding a protocol of a brief hearing screening test for patients coming to the memory clinic here and at Bruyere in Ottawa.
Fantastic. Well, I really want to thank Marilyn Reed for shedding light on this incredibly important topic, common, serious, a potentially modifiable risk factor with dementia, and just something where there's a lot of practical interventions that people can do to help with the hearing loss that might have a substantial impact on their social life, possibly cognition, and certainly in terms of interpersonal relationships with care partners. So I want to thank Baycrest for hosting us, and really want to thank the CABI group, which is housed and powered here at Baycrest. So the Center for Aging Brain Health Innovation, that's been generous with our iGeriCare initiative and also with some of Marilyn's work. So that's been great. The Jerris Center at Hamilton Health Sciences, McMaster University, the Hamilton Health Sciences Foundation, our Alzheimer's Society Foundation of Brant, Haldeman, Norfolk, Hamilton, Halton, and our Division of E-Learning Innovation, as well as our crew that did the road trip to Baycrest today. So thanks as always. Teamwork makes the dream work, but the other thing that makes the dream work is the donate button at the top of the iGeriCare.ca website. So please take a moment to fill out the survey. Vote for your next live event topic. Our next live event is Wednesday, April 8th, same time, same bat channel. Topic to be determined based on you, the voting public. So please, the survey's pinned up at the top of the Facebook comments, and we really do listen to everything. I want to thank people for their participation today and sending in some great questions. And again, thank you, Marilyn, for joining us, and we'll see you next month.
Thank you for having me.